So with that, let's bring Stephen up and hear the story.
Woohoo! So I'm 6 years old and it's about halfway through first grade. I've just gotten to my homeroom and I've discovered that I left my notebook at home and it's starting. I can feel my chest getting tight. I can feel my body getting hot. The room is getting smaller and my mind is moving up towards the ceiling and I can kind of see myself in third person. And I can't stop what has happened many, many times before. I kick the desk out from under me. I throw myself on the floor. I'm kicking, I'm screaming, I'm spitting, I'm crying, all while my mind is still hovering above me. And I'd been experiencing these things for a while, what some folks would later call a sadoseizure, what I would call today a dissociation, but I didn't know any of this. I'm only 6 years old. And this was kind of the beginning of my long, arduous mental health journey. I was eventually removed from public school and placed in a special education program far from home and started going from psychologist to psychologist, hospital stay to hospital stay, research lab to try and figure out what was quote unquote wrong with me. Fast forward a few years and I'm 10 years old and I'm now taking a cocktail of medications, everything from medications designed to help with childhood schizophrenia to depression. And I get a referral to a Dr. Gabriel Carlson at Stony Brook University. And she was the first one to sit there and say, well, the only way we're going to rule out these behaviors to determine if they're seizures or not is if we hook up what's called an electroencephalograph or EEG to this child's head, a series of electrodes that are glued to the scalp for 24 hours to rule these things out. And so I spend the next week at Stony Brook Medical Center with these devices awkwardly glued to my head. And Dr. Carlson determines after that week that we are not dealing with seizures. And she is the first one to give me a diagnosis of a pervasive developmental disorder not otherwise specified, which basically just means we don't have a name for what this child has. I would be diagnosed on the autism spectrum now. It was also around this time that I was always an artsy kid. And so I had discovered poetry. And poetry was helping me to communicate to myself my own experiences and helping me to communicate to others what I was experiencing. And it was because of Dr. Carlson that I was taken off of these medications and I was given structure and safety and predictability as much as life can give you, which really transformed my healing. Fast forward a few more years and I've now graduated from high school and I'm starting my time at a community college. And I'm reflecting on all these strange memories that I'm having because my parents never divulged to me or explained to me any of the things that I was experiencing. And I'm also trying to figure out what I wanted to do. I was writing poetry, but I didn't know what career path I wanted to take. So I went up to my mother one day and I said, Mom, what are all these weird experiences that I have? Hospital stays, psych appointments, two-way mirrors. And my mom takes me upstairs and she goes into her room and she opens the closet and she goes way in the back and she's rummaging through and she pulls up this beat up cardboard box and she hands it to me. And she says, I knew one day you'd come asking about this. And so I kept these. And they were every psych exam, every evaluation I had ever taken. And that's when I first learned about Dr. Carlson and PDD and all these. And finally, I had a physical evidence of the strange memories that I'd had ever since I was a child. And that's when I became really fascinated with psychology and decided I wanted to be a mental health advocate. Fast forward a couple more years. I'm now a grad student at Stony Brook University studying social work. In the evenings, I'm traveling around New York and I'm performing poetry for crowds. And I'm working at a research lab as an EEG tech, where it's my job to glue electrodes onto people's heads to measure their brain waves. And I'm carrying these goopy, clickety electrodes down the hall to clean them up. And I look over and I see a placard that says, Dr. Gabriel Carlson. And I realized that I was working down the hall from her. So I found her contact information and I sent her an email and I said, hey, not sure you remember me. I was one of your patients. You changed my life. She got back to me and she said, "Ah, yes, last time I saw you was in 1995. I have your file right here. I hope you're doing well." And I was doing well. And I realized that that loop had closed, and now it was my job to pay it forward. And this story is about a kid that was just trying to understand his experiences, who is now an even bigger kid that gets to use those experiences to inspire others to understand theirs. I'm now a social worker who works with children in crisis, and I have the absolute gift of traveling the world as a spoken word poet to use the power of poetry to help other people tell their stories. So thank you so much.
Ooh, goodness.
Amazing.
Wow.
Woohoo.
Wow.